That right there is a mountain of paper. Countdown to the vote on the health care bill in the House. House Minority Leader John Boehner doing the honors yesterday, thumbing through 1,990 pages yesterday in the press conference the Republicans had. This after the House Speaker Nancy Pelosi delivered the monster piece of legislation. It lacks what Pelosi dubbed a robust public option. Democrats compromising, hoping to pick up more support from the moderates in their party. Republicans say the Speaker's not telling you the whole story. They have put out 10 facts that every American they believe should know about the bill, according to the Minority Leader John Boehner. Here's 3 of them. It raises taxes, they say, on middle-class families. There's massive cuts to Medicare benefits for seniors, and no protection for small business. With me now, the Ohio Republican House Minority Leader John Boehner. Sir, good morning to you. Welcome back here from Capitol Hill. What else do we need to know, do you believe, that's in that bill?
Well, all you need to know is there are 1,990 pages. That should tell you everything. You know, it's not just the public option, which I think will drive private health companies out of business. It's the over 50 new agencies, boards, commissions, mandates. They're going to raise the cost of health insurance for all Americans. It's going to be immensely expensive at a time when we're broke. And thirdly, $500 billion in cuts to Medicare. Bill, I've got 27,000 Medicare Advantage enrollees in my district. And according to the Congressional Budget Office, the cuts to Medicare Advantage will result in about 80% of them losing the coverage they have and forcing them into traditional Medicare.
Well, that's how the bill is designed to pay for itself, right? I mean, in large part, you got to get these Medicare cuts, and they're going to come in the form of hundreds of billions of dollars. Can you give me an example in Washington where Medicare was cut in the past, where it was said to be cut and actually followed through on its word, and we saved money in that program?
Well, back in 1997, the Republican Congress, along with President Bill Clinton, put together the Balanced Budget Act. And in that act, there were cuts in the rate of increase to Medicare of $247 billion over 10 years, agreed to by both Republicans in Congress and the Democrat Bill Clinton. And what we were doing is slowing the growth of Medicare. But this is far beyond slowing the growth of Medicare. In about 2003, we had the Deficit Reduction Act, where we reduced the growth of spending of Medicare by some $10 billion. And so reducing the growth is one thing. But when you go in there and virtually eliminate a program that millions of American seniors depend upon, this violates what the president said. When he said that if you like the plan you have, you can keep it. Well, clearly, if you're on Medicare Advantage, that's not true.
Yesterday, you were at that podium, and I just showed the videotape carrying that thing in there, and or that thing, I say. That thing is a health care. I imagine it was. We carried 1,500 pages last week, and this is about 450 pages longer than that. You are encouraging people to go to your own website. It's healthcare.gop.gov specifically for this issue. I was there this morning, and there is an outline for what Republicans like to see, including medical liability reform. This is tort reform. Based on what I can see, that's not in the bill. Is that true?
It is not in the bill.
Okay, that's one thing. Buy insurance across state lines. That's another thing you propose. Is that in the bill?
That is not in the bill.
Okay, another thing is wellness care and prevention, described in different ways, I'm certain, depending on how you look at the health care issue. Is health care, prevention, and wellness a cornerstone of this bill to make America healthier so we can save money in the long run?
We don't know yet. What we do know is that the word shall is in their bill 3,425 times. Now, when you talk about the growth of government and this big bureaucracy here in Washington and all the mandates and taxes in this bill, that's why the word shall is in this bill 3,425 times. This is exactly what the American people have been saying for months that they don't want. Republicans have better solutions, and we think a step-by-step approach to make our current system work better will bring down the cost of health insurance and make it more affordable for Americans.
Well, I think that's the point of this discussion. How do Republicans counter? What do you offer? How do you make the bill better? I mean, everybody knows health care costs are going up about 10% a year for the average American family. How do you cut into that cost?
Well, you don't make this bill better. You just take this bill and not pass it, and pass about 8 or 9 separate small bills that says, let's get rid of junk lawsuits. Let's allow Americans to buy insurance across state lines. Let's let individuals and small employers group together so that they can buy health insurance at the same kind of prices as big companies and unions do today. These are common sense things that will bring down the cost of health insurance and make it more affordable for more Americans.
You ran a small business, right, before you were in Congress? And oftentimes you like to describe that business and how it worked and how it operated and whether or not you were profitable. If you had to compete against the government in that business, how would you fare?
Well, that's why this government option is a joke, because the government has no cost of capital. The government's going to write all the rules, and it's real clear that they're going to drive all the private health companies out of business. This is, and so
the way
everybody's
it's
going to end
described, Leader, is that the robust public option is not in this bill. Now, is it or not?
Well, listen, the only thing different about the public option is how much they're going to pay providers. The big robust public option is in this bill. And I think this is leading us toward a single-payer national health care system. And it's going to bankrupt our kids and grandkids. This is exactly what the people of America don't want. They want a more step-by-step, gradual approach that'll fix the problems in the current system, and that's what Republicans will be offering.
All right, John Boehner, thank you for your time. On the Republican side, fair and balanced, sir. Thank you for your time on the Hill.